Also sitting with me today is Bradley Walter. Bradley's an HIV patient from right here in Pennsylvania. He has had the courage and generosity to open himself up to the media and to many of you legislators. Many of the patients here in the room today, you'll see them filling this room, have submitted to you written testimony. Many of you have heard from them on the telephone via email. We have directed our supporters to contact you, and I know they have. I want Bradley to take a moment to tell his story here. Just a moment. I just want to cede a moment of my time to Bradley Walter.
Thank you, Chairman Oliver and other members of the committee. As you told, my name is Bradley Walter. I'm from Marksville, Pennsylvania, and I'm 31 years old. I live a very healthy, active life, being HIV positive thanks to a combination therapy of medications. They keep me healthy, active, and going. They keep my viral load down, and they keep my white blood cell count up. That is what fights the infection. One downside of those medications that I take, which are a lot of pills each day, is severe digestive problems. Every day for me it's spent dealing with diarrhea, constipation, digestive muscle spasms, unbelievable stomach and intestinal gas, and in the worst case, inability to eat without immediately vomiting. On my best days, I spend up to 3 hours in the bathroom a day. These digestive problems are nothing new to anyone who is on or takes antiretroviral therapy. The one thing that provides relief for me is whole plant cannabis. It stops the muscle spasms and allows me to maintain a properly doctor-monitored weight. My weight is monitored by my infectious diseases doctor, Dr. Shubrachetti of the Scranton Temple Healthcare in Scranton, Pennsylvania. She supports my use of whole plant cannabis as a primary means to control and lessen mine, as well as other patients of hers, gastrointestinal pain. Representative Baker said that there are medicines out there that can do the same thing as marijuana. I am currently prescribed the largest daily dose of Marinol that the FDA allows. And I can tell you, it does not. It does not provide the same relief. All that it does is make you hungry. And when you're hungry with stomach and digestional pains, it's even worse. Thank you. Thank you.
Bradley submitted written testimony to this committee. You can read about his experience and his experience with Marinol as well. There is several scientific studies that compare marijuana to whole plant cannabis. We've submitted that to members of the committee as well. I just want to point out a couple of interesting facts here as we consider this in Harrisburg. It is very important that we consider medical marijuana legislation. Pennsylvania has a strange, peculiar part of the marijuana prohibition history. In 1937, the Marijuana Tax Stamp Act was introduced in Congress by the racist prohibitionist Harry Anslinger Jr., who was raised in Altoona and is buried in Hollidaysburg. The only person to stand up at the 1937 hearings against the federal prohibition of marijuana was the chief legal counsel of the American Medical Association. In 1937, they said that the point of this Tax Stamp Act, and that's what it was, a tax stamp, they never produced any. It was ruled unconstitutional. The Tax Stamp Act is to control this medicine and how it may far serve to deprive the public of benefits of a drug that on further research may prove to be of substantial value is impossible to foresee. In 1969, the tax stamp was struck down as unconstitutional. We rolled out the Controlled Substances Act. Marijuana was put in Schedule I. A Republican governor of Pennsylvania, former Governor Schaefer, chaired a presidential commission by President Nixon. It was the Commission on Marijuana and Drug Abuse. They spent 2 years looking at marijuana around the country. The recommendation by Republican Governor Schaefer and his commission was that marijuana be removed from Schedule I in the Controlled Substances Act and that it be decriminalized for personal use. President Nixon ignored that recommendation, and here we are today. There is further research that I offer in my testimony. The current American Medical Association science report that came out 2 weeks ago, the Department of Justice memo. You'll hear today from the opposition. They'll try and bring up issues that are not related to medicine. The opposition today will draw on some of the same reefer madness rhetoric and tactics that worked 70 years ago for the racist Harry Anslinger in Congress. Somehow they'll try and bring up the recreational marijuana market in relation to our talk about medicine. That's wrong. Medical marijuana and recreational marijuana are separate. That's the whole point of this legislation. We want patients out of the underground market.
Hello.
We want to have a safe
I
supply.
understand.
Yes, sir.
I'm going to cut you off at this one.
Yes, sir. Do you have any questions I'd like to answer for the committee?